Rhinoplasty traditionally was always performed with surgical intervention. That means invasive procedure. Rhinoplasty in common layman's terms means nose job, whereby because of either cosmetic reasons or sometimes because of functional problems, that means the patient is having difficulty in breathing or excessive snoring, the shape of the nose needed to be altered, and that is primarily what rhinoplasty used to be, surgical procedure. Rhinoplasty has always been performed with surgical intervention. That means it involved a surgery or an invasive method. However, over the last 6 to 8 years, we have noticed that medical rhinoplasty is gaining popularity. It is usually performed with either a dermal filler or botulinum toxin. To alter the outer shape of the nose, dermal fillers are very effective, and we can even camouflage the hump or sometimes alter the shape of the nose. With botulinum toxin, we can reduce the nasal flare, and often people who have got a depressed nasal tip, we can alter the depressed tip so that it looks slightly elevated. This is more suitable for people who are not so keen to undergo any surgical methods to correct their nose problems. Non-surgical rhinoplasty or medical rhinoplasty, like any other cosmetic procedures, has some pros and cons. As doctors and nurses, we need to be acutely aware of that to protect our patients. The pros are mostly that it is a minimally invasive or non-surgical procedure, so the patient doesn't have to go through a surgery. But on the other hand, you can get dermal filler being injected into the blood vessel, which can cause skin necrosis and other significant problems. Botulinum toxin, as we know, can be injected into the wrong place and cause unusual expression of the face. Similarly, all the pros and cons need to be taken into account before we undertake this procedure to keep the patient happy but safe.